Good morning, everybody, and welcome back to your Lunch Break Live. Today is Thursday, January the 7th, and we know there has been tons of news in the past 24 hours. There's been a lot going on in Washington, but we have to remember coronavirus is unfortunately still a thing and is still happening, and the vaccine rollout is still a thing and is still happening. So today I am talking with Alabama Department of Public Health, Dr. Karen Landers, to talk about this vaccine rollout, to answer some kind of commonly asked questions about the vaccine rollout and when people will be able to receive their vaccines. So, Dr. Landers, thanks so much for coming on, answering these questions. I know that you're busy and I know you have a lot of questions that people throw at you.
Absolutely. Thank you, Ivana, for asking me today.
Yes, doctor. Now, let's start out with just the numbers from the Alabama Department of Public Health website. The information there is that there have been 42,810 vaccinations given, and that is out of the allocated 226,250 of those vials. So 42,000 out of the 226,000. I'm not great at math, but it's a small number. Is this rollout how your agency thought it would go, or is it going either faster or more slowly than you expected?
Well, first of all, let's speak to those numbers in context and remember that those were our numbers as of Monday morning.
Okay.
And every day clinics are vaccinating, and we have had more persons being vaccinated each and every day. And so that number will change. We will update that number once per week, and likely we'll be vaccinating and updating even more than as that has shown at the moment. So I think we need to take it in context. And I think if we look at starting out just about 3 weeks ago with one product and 15 hospitals, and then, of course, with an additional product being approved and additional hospitals coming on board. And then our third week, the Alabama Department of Public Health was able to receive vaccine for our clinics, for our health department clinics. You know, this is where I compare this to being like a locomotive, if you will. We're starting the fire, we're building up steam in order to be moving down the track. So certainly all of us would like to vaccinate more quickly, but I do believe the process is moving along in a reasonable manner, and I think we're going to continue to pick up more and more each day.
Do you think as our healthcare workers get vaccinated, and as those frontline workers get their vaccinations, that will kind of help speed up the process for the next phases?
Yes, I do. And I also think that we have to remember that some persons are hesitant to receive vaccine. And of course, certainly right now we're vaccinating in the health care population with a couple of other groups that we've started to do some vaccination with. But to remind people that the more people that receive vaccine and persons recognize and understand that those persons have received vaccine and done well, that will increase vaccine confidence, and that will increase persons' ability to make decisions to take the product.
So we're still in that first phase of the healthcare workers, and we know some nursing homes that have been going through those vaccinations, getting those people who want to be vaccinated their doses. But when do we expect to move on to that next phase, that 1B phase?
Well, as I mentioned in a couple of other discussions that I've had recently, Alabama is actively engaged in the full scope of our Phase 1A, which is our healthcare providers. And that includes a number of persons, not simply doctors and nurses, but also persons who work in the healthcare system, who work in hospitals, work in doctors' offices, in support roles, also our healthcare professionals in the dental profession, dentists, dental hygienists, laboratorians, and again, a number of other persons that are in our plan as prescribed by the Advisory Committee on Immunization Practices. What I do expect is that each county or region may be in a different phase, and there are some counties that, due to the saturation of vaccine and the uptake, have been able to start to vaccinate some persons in the 75 and above age group, and also in our law enforcement and firefighter community. So I do expect that we will have some soft transition into that group of persons and continue over the next couple of weeks to expand in that category.
So you talk about those soft transitions going into that 75 and up, the first responders. So does that mean that there will be these soft transitions, excuse me, in different parts of the state instead of the state just kind of flipping a switch and saying, okay, we're done with 1A, now we're going to 1B?
Yes, because really, when we think about 1A, that's over 300,000 people. And we also have to recognize that there will be persons that will be entering the 1A category. For example, new graduate nurses or persons that get jobs in hospitals or in other healthcare facilities. So we will not be finished with 1A. We will continue to vaccinate in 1A, and then we will expand forward with additional groups as the supply allows. Right now we're looking at literally a supply and demand. And once we add the full scope of our persons 75 years of age and older, in Alabama, that's another 300 plus thousand people. So we certainly know that the supply is going to be, less at the moment than the demand for the vaccine.
Do you expect to be getting regular shipments of these vaccinations of this medicine, or when do you expect to get more doses?
Well, each week we have an allocation from which we can pull, and the overall allocation in Alabama is determined using a micro planning tool called Tiberius. And this takes into account, of course, with our healthcare workers and also some of our demographic information, population, etc. But yes, we will have and have started to have, if you will, one of my colleagues has called it a cadence of vaccine that will be allocated for Alabama. Now, remember, a certain amount is allocated for Alabama, then we have to have providers to order that vaccine, so that vaccine is shipped directly to the provider, so that again the allocation is there and the amount to be distributed is pulled from that allocation and shipped directly to the provider to be able to vaccinate patients.
Seems like this is a long process of getting that medication. It's not just like you get on your phone and you call somebody and say, "Hey, I need 15,000 more doses of the vaccine." It seems like this is a little bit harder to get maybe than most people are thinking for the health department.
Well, I think it's, one thing that Operation Warp Speed has done is when an order is placed, again, the order goes into the queue, the order is placed at a certain time. And of course, the distributor, if you will, there is a central distributor, provides that vaccine through the point of distribution. And we've been able to get vaccine by the various mechanisms within 24 hours of orders, but we have to order again at a certain time, and then the vaccine comes in through the various mechanisms within a day or so of ordering.
We have so many people that no matter what stage in the process they are, whether they're 1B, 1C, or the general population, they want to know, how am I going to know when it's my turn? Will I get a call from my doctor? And if so, what if I don't have a normal doctor? What is the information that we have so far about how people will be informed when it's their turn to get vaccinated if they choose?
Well, we have various ways to inform. One way that we are informing, of course, is through our vaccine page that we have on the Alabama Department of Public Health's website. We also have our presence on social media. We provide news releases and updates, but we also are establishing a 1-800 line where persons can call and receive information about when we will have a vaccine available for their age group or their specific designation.
I have several people, especially I was trying to find the comment that I looked at. I believe it was from Lucy, saying that they called their local health department and were trying to be able to sign up through the local health department or get notified that way. Is that another option?
Right now, we're directing the phone traffic to the line that we are setting up. The reason being that the local health department is actively engaged in the vaccine process. However, if persons call their local health department and their local health department has a clinic and is engaged in vaccination that day, persons can be advised regarding whether or not vaccine is available for their group. But we are directing most of our traffic to the phone line that we are getting ready to go active so that persons can have a central hub, if you will, to be able to call.
So that 1-800 number is not yet active as of today.
Right, but we have some numbers that are available, but this number is going to be activated within the next day or so.
So everybody asking for that phone line number, we'll get it as soon as we have it, hopefully in the next day or so, according to the doctor here. Now, interesting question that we have somebody who just asked. Her name is Karen. Karen says, are people who participated in a vaccine trial going to be able to get a vaccine because I feel like I might have gotten the placebo?
Well, again, as you know, with the clinical trials, that is through the individual manufacturers who provided the vaccine. And so that will be a decision made by the clinical trial that the person is enrolled in.
So check with the person in that trial instead of the health department for that one. And asking about the phone number. As soon as that happens, we'll get it out to you, Ann, and I'm sure the Alabama Department of Public Health will be blasting that number out on all of their internet and social media channels as well. And this is a interesting question from Diana. I'm not sure if you have the answer to this one, Dr. Landers, but she says that when this starts coming out, where can deaf persons locate that information if they can't call in?
Well, as part of our system, we do have persons that can respond to the hearing impaired community. But if there is a question about that, if they have one of their family members that can call, then we can connect them with the hearing impaired community to be able to communicate with them.
Very interesting question, because unfortunately this is a virus, and this is a situation that impacts people of all abilities and all across life, all walks of life, as we say. I want to move on to the back to the vaccine doses we talked about a minute ago. And that is a question that we've heard a lot about, the doses that have not been given out. We know that at least with one brand of these vaccines, they have to be kept at a certain temperature for a certain amount of time. So is there any danger of these vaccine doses that have not been injected yet, maybe expiring or going bad?
Well, that actually is a commitment that the Alabama Department of Public Health has made from the beginning. Again, certainly the cold chain has to be maintained. One of the issues that we have to work with each day, as well as any vaccine provider, is that once the vial is punctured, you have a certain amount of time to administer the doses in the vial. So there are 5 doses in the Pfizer vial. There are 10 doses in the Moderna vial. These vaccine products are not interchangeable. So basically, if a person receives 1 dose of a certain product, their second dose needs to be with that product. So what we actually have done is that is part of our appointment system. That's part of the way we book, so that we book to be able to utilize the vaccine. Now, at the end of the day, if we have a couple of doses left, we do have persons either within the health department who are on the list to be able to take the vaccine so that we will not waste a dose. Or in some places, we have groups of providers. For example, last week we had a few doses left, and the clinic called one of the local first responder community groups and was able to have persons come in and take those additional doses. And our commitment is to not lose a dose of vaccine in the state of Alabama. We want to make sure that every dose is appropriately used for patients.
Question from Belinda, and this is, I believe, especially when we get out of this healthcare worker phase and the nursing home phase. And she says, will vaccines be given at places that our big box stores, our Walmart, Target, our pharmacies, our grocery stores? Will that vaccine be accessible through those locations?
Yes, and certainly one thing I want to remind is that the Alabama Department of Public Health will not be able to vaccinate every person as local county health departments. I mean, we just do not have the staff to vaccinate everyone that's going to need to be vaccinated. So we are relying already on our community partners to be involved. Again, our hospitals have been very significant community partners because they obviously needed to vaccinate the healthcare workers first and the first responder community, but also pharmacies, physicians' offices, urgent cares, and perhaps even some industries, once we get out of this phase, industries that may have their own occupational medicine department. Now, that's a bit further down the road, but yes, local pharmacies can receive the vaccine. They have to register an imprint, which is our electronic surveillance system and system for vaccine. They have to register an imprint and ensure that they have the appropriate cold chain capability for the vaccine. So local pharmacies, yes, absolutely, and even larger pharmacies, we expect to be actively engaged in the process.
Now, we know that some people do have fears about taking this vaccine, do have trust issues about the vaccine. Have you seen anybody either in the department or anybody that you have heard of that has received a vaccine dose so far, having any extreme side effects from that dose?
Well, as we mentioned, I believe in a news release that we did actually have a person in Alabama that had an anaphylactic reaction, which is an allergic reaction. As part of the vaccine administration process, each entity providing the vaccine has a pre-screening of persons regarding any previous history of anaphylaxis with biologicals, and consent if that person chooses to go ahead and take the product. There is an observation period, 15 minutes for persons who do not have a history of allergic reaction, 30 minutes for persons who have a history of anaphylactic reaction to biologicals. And each entity is set up to manage anaphylaxis regarding the patient again. So the person who did have an anaphylactic reaction was rapidly and appropriately assessed and managed and has recovered from that allergic reaction. It is a small number, but it certainly can happen. And that's why protocols are in place to manage this reaction and also to follow up through VAERS, the Vaccine Adverse Event Reporting System, as well as other mechanisms for vaccine safety, including the V-Safe program that CDC has set up.
Interesting question here from Dana. And he says, will government agencies and essential workers be able to set up their own clinics where they can vaccinate all their employees at once?
Well, again, as I mentioned, there could be entities that have licensed healthcare professionals, such as an occupational medicine department. And if these persons are able to have, again, a licensed professional or group of licensed professionals to provide the vaccine, as well as have enrolled in the imprint system where they can input the vaccine doses into the system to account for the doses, and also have the ability to manage the cold chain, the storage of the product, depending on whether it's the ultra cold product or the product that requires a regular vaccine freezer. Then certainly they can go on the imprint page, register as a provider, and get in the queue to become a provider for their entity. And we hope that entities who have that capability will do so, both for the convenience of their employees, as well as just another group of people to be able to address the numbers of people who will need the vaccine.
Now, question from D, and he says, are private doctors offering the vaccine now?
At this point in time, there are very few physicians in Alabama who have received their COVID-19 vaccine. Some have already received vaccine and are engaged in vaccinating in their communities. Others are in the queue or in the process of receiving their shipment, so they will be able to vaccinate in physicians' offices.
I want to move on a little bit and talk about something that unfortunately is not great news, and that is a different strain of coronavirus. We know this has been confirmed in surrounding states to Alabama. We know that Tennessee and Georgia have had confirmed cases of this strain. Number one, do you believe that strain is already in Alabama?
Well, I really would not have a reason to think that an additional strain could not be in Alabama. One of the ways that we are surveilling for this or watching for this in Alabama is that each week our Bureau of Clinical Laboratories provides a certain number of specimens to the CDC for what's called sequencing, which basically means that the CDC analyzes these specimens to determine if we do have the mutation or the strain that has been most recently noted. Now, keep in mind that viruses mutate, but this particular strain appears to have more mutations than some of the others that we have seen. And I also want to remind, as part of this, that at least at this point in time, while there is information that this strain could be more contagious, we do not have an indication that it provides more severe or causes more severe disease. And we do not have an indication that the presence of this strain changes our vaccine strategy.
Now, you say that we don't know that this would be any more severe than the current COVID-19 virus that we're battling right now. We do know that it could be more contagious, like you just said. Do we know if the vaccines that we have here in Alabama would be able to protect against that strain?
As of the information that I received on a call with CDC earlier in the week, we do not have any indication that vaccine would not be effective. In other words, the presence of this strain is not changing anything related to our current vaccine strategy.
Question about antibodies. What does it mean if you test positive for antibodies? Should you still plan to get the COVID vaccine?
Yes, and really, if we look at the subject of antibody testing, we know that the accuracy of antibody testing varies widely depending on the test that is available. And some antibody tests that were approved early on emergency use authorization were subsequently asked to be removed from the market by the FDA because they weren't considered accurate due to cross-reactivity with other coronaviruses. So really, antibody testing is not an indication in terms of management of a person who has COVID-19 disease. Really, antibody testing should not be used as a diagnostic. If a person does have antibody test and the antibody test is positive later on, that still does not mean that they have immunity to COVID-19, and persons should still be vaccinated even if they have a positive antibody test.
We are unfortunately coming up on a year of battling coronavirus in our country and in Alabama, just a couple of months away from that marker. And people are, of course, we hear this word all the time, this COVID fatigue that people have. And we do know that I don't know anybody who doesn't feel that way, who is not tired of these restrictions, of staying at home, of the guidelines. What do you say to people who believe, well, look, I've stayed at home since March, I'm tired of it, I'm going to do what I want to do?
Well, certainly at this time, we clearly understand there is not a person that has not had some impact from COVID, whether that's within their family, whether that's within a group of friends, job impact on their job, having to transition or change into different types of work, the mental health, and of course, the very regrettable situation of many persons dying from this virus. And we know that people are tired of this. And what I would say to people now is, even though we are tired of this, we certainly have a reason to be hopeful, and that is the vaccine that is coming out and that we are providing, and that we will be able to provide to more members of the population, certainly later on in the spring and summer. So let's do all we can right now. Let's take it upon ourselves as individuals to really be part of the solution, and that is following the mitigation standards ourselves, following the respiratory hygiene, the social distancing, the use of the mask. Now is not a time to abandon this, because we need to preserve our hospitals. We need to preserve the ability of our healthcare workers to take care of patients, whether they have COVID-19 or other diseases. And I can say, as a physician myself, that what I have seen, what I have worked with in terms of outpatient information related to COVID-19, that everyone's tired of it. My daughter's an emergency medicine physician. She's certainly tired of it. Many of my friends and colleagues that I went to school with, we're all tired of it too. But let's work together, because that is the way that we can defeat this virus, is working together as a group of people, as a citizenry of this state, that is the way we can defeat this.
You're so right. And I think if there's one thing that we've all learned from the past year is that we can't do this alone. We have to work together. We have to have each other. And that brings me to that glimmer of hope you talk about, that at least we have the vaccine. We are getting there. I know you don't have a specific date when the state will flip a switch and go to 1B, 1C, 2. But what is your general idea of a timeline where people could start seeing that they would get vaccinated, whether that be people that maybe are not over 75, but that have serious pre-existing conditions, or to the general public? What kind of month should they be thinking that they might be able to get vaccinated?
Well, again, some of this is going to depend upon the supply of vaccine that we currently have. And another factor is additional products that could receive emergency use authorization, which would allow us to further expand our range of vaccine products. And I think at this point in time, given the supply that we have, we're really looking into the spring before we can really start seeing much expansion. Now, certainly Alabama, again, bases its vaccine plan upon the Advisory Committee on Immunization Practices guidance. And we do know that persons are anxious to get the vaccine, and we're going to move into the subcategories as expediently as that supply allows. But I really think we're looking at a couple of months before we start to see more widespread product available. So, I'm reminding people that we're still in the winter, we're still in the respiratory season. We need to do all of our preventive measures and look toward the spring and summer to really have more widespread usage of the product.
And that spring timetable almost seems like we could be getting a lot more vaccinations coming at that 1 year mark, that kind of March 13th, 14th, where most of us might have had our last day in the office, might have had our last company lunch, or our last kind of normal life activities.
Right. Well, and again, I think that everyone is anxious for that. And certainly we are hopeful that not only will the supply continue to improve, but also that, as I said, additional products will come on board that will give us a much better range of offerings to be able to vaccinate in a more widespread manner.
Fingers crossed on that one, Doctor. Thank you so much for your time. Thank you for coming on here, answering some of the questions that I think we all are thinking about and that we're all asked very often. So again, Dr. Landers, thanks so much for all your information, and we'll be sure to get out all of that information you might come out with in the coming days and weeks about when people can expect to get their vaccines.
Absolutely. Thank you, Ivana. It's been a real pleasure.
Thank you, Doctor. Everybody, thank you so much for watching. We will see you tomorrow, where we will be talking with Dr. Michael Sag at 11 a.m.